Thank you. Welcome again to another episode of Connecting the Dots podcast with me, Juliet. On this episode, it's our final episode of the year, and we've decided to pull a chair and really reflect on the year that has been, especially for science. So, if you've been following the news this year, you might be left with two big questions about the future. As leaders and institutions seem to be pulling back, we're asking ourselves, who is moving forward, and what does that mean for our health and our planet? It has been a defining year of global science marked by profound challenges and resilience. We felt the shockwaves. Major shifts in global funding and policy forced an urgent reevaluation of how progress is sustained. Yet, in the face of the threats and in the face of these upheavals, we also witness a powerful counter-narrative. For example, African leaders in Addis Ababa at the African Climate Summit really took on the reins to be able to set a declaration about how they wanted to see global financing, climate diplomacy, not to mention the vital and often overlooked work of local communities and eco-justice activists on the front lines restoring their ecologies. In addition, these are strides made by researchers in the field of healthcare. On today's episode, we're holding up a mirror to this year in science. Our guest shares his reflections on the year we've had, what he thinks we should carry into the next year, and perhaps some of the things we need to leave behind. I am joined by Professor Ntobeko Ntusi, who is the President and CEO of the South African Medical Research Council, SAMRC. He's also the Professor of Medicine at the University of Cape Town. His lifelong passion for evidence-based healthcare, non-communicable diseases, and universal health coverage has positioned him as a trailblazer in medical research. Welcome very much, Professor Ntusi.
Thank you very much, Juliet. It's a delight to be here.
We'll start on a high note. What have been top 3 highlights for you this year, broadly in your field, and also in scientific development generally?
I would say the first has been the approval of lenacapavir as a new drug for HIV prevention, and South Africa being the first country on the African continent to register this drug. And of course, the ground-breaking work of the PEPOS trial led by Linda Gale Becker and colleagues. I was also led from this country with 25 of the 28 sites in South Africa and the other 3 in Uganda, demonstrating that this was a very powerful and effective 6-monthly injection that prevents 100% of new HIV infections. And so I'm really excited to support the rollout of this new form of HIV prevention, which we hope will be the key step in the last mile of really bringing HIV to its knees as an endemic infection in our region. And for our scientists to contribute to the implementation science that will improve our understanding of appropriate localized approaches for implementation. So that's the one excitement. The second, we announced last week the launch of Africa's first T7 genomic sequencer at the SAMRC. This is a powerful form of technology made possible through our collaboration with the MGI and BGI groups from China, and provide us with long-read technology for genomic sequencing, which is faster and cheaper with far greater throughput than many of the current platforms have, which really positions our SAMRC genomic platform is a leader in the region in supporting sequencing work, both for clinical services, but also for research on infections and non-communicable diseases. And the third excitement, while clearly scientific, is more of a political victory, which is really a celebration of how the South African national research ecosystem has navigated the funding crisis for this year. At the beginning of the year, when the new US administration came into office, we saw significant changes, which posed quite an existential threat without adequate time for mitigation. And we've been able to work very closely with the leadership of the NIH, but at the same time, convince our government to see the value of science as a key driver of human capital development and the generation of a knowledge economy, and to invest substantially more in health science in this country. And at the same time, we've worked very closely with many of our long-standing global partners and co-funders like the Gates Foundation, Elma Philanthropies, Wellcome Trust, and others who have come to the party in a big way to support us. And so as we come to the end of the year, I think our national research enterprise has navigated these choppy waters, showing significant fortitude. And I think we emerge on the other end looking even stronger than we were at the beginning of the year. So I think those are three things worth celebrating as we reflect on the year that has been.
No, and those are fantastic highlights, and Ntobeko, from the advancement in HIV treatment. Lenacapavir has really changed it for people who are suffering from HIV or infected with HIV to be able to get treatment quickly. And then just advancement even for the sequencer. Congratulations, first of all. And I think that just shows some rapid advancement and movement to be able to do sequencing work on the continent. I'm hoping that South Africa will share with the rest of the African countries. I know it's a big one.
National and regional core facility. And so we support science not only in our own country, but beyond our borders, and keen to make these discounted rates available to scientists from throughout the region.
Yeah. On the third high, I want us to spend a little bit on that point about global financing and the impact that has had on global health. I listened to a talk that you recently gave at the Funders Forum where you were talking about the poly crisis. Could you share your perspective into the year we've had through the framework of the poly crisis and what that actually does mean?
So the poly crisis is not a new concept, but it's a concept that reflects on the interconnected and overlapping global crises that pose significant threats to global health. These exacerbate and amplify their individual impacts on health, creating new health burdens, worsening health disparities, and worsening health outcomes. These crises include economic downturns, civil unrest, forced migration, the planetary emergency, environmental degradation, pandemics, and new infectious disease outbreaks. The rise of nationalism and right-wing politics, authoritarianism, increasing supremacy, increasing racism, and saviorism. And these crises are not isolated, but really reflect a change in geopolitics that is associated with weakening multilateral integration and a economic driver of a new world order that favors nationalism over global solidarity. And this polycrisis, I believe, exists when present and future risks interact with each other, such that the overall impact exceeds the sum of each part. In today's world, these simultaneously overlapping crises are impacting significantly on available funding to support health research and health services, reducing the favorable outcomes in health, and individuals in context of precarity are much more severely affected by this.
Right.
And so that's really the polycrisis that we are living through. And when one takes a lens through an understanding of the political determinants of health, one comes to appreciate how very perverse economic drivers of these geopolitical events are at the center of the impacts we are seeing on healthcare world over.
And on the global financing crisis, whether it's a crisis or an opportunity, again, in your talk, one of the interesting points that you made is you said 5 countries make up more than 90% of international global health funding, with the US accounting for almost 80% of global health funding. So I wonder, in your view, and I'm going to almost shift the question a little bit, in your view, do you find this as a crisis or an opportunity, even for domestic financing and African governments, to rethink how we do global health funding?
Yeah, so there are many things that are wrong with the current and broken system of global health, and one of
Right.
this has been the over reliance to support global health on aid from high income countries. And as you mentioned, 5 countries, the US, the UK,
Mhm.
France, Germany, and Netherlands, collectively account for more than 90% of the funding for global health at the beginning of this year. And all 5 of these countries, inter alia, many others, have announced significant reductions in their ODA, or Overseas Development Assistance budgets. And what this means is that there is going to be a significant reduction in the funding available to support global health in the
Okay.
next 5 years. Many people are predicting that this could be anywhere in the region of 20 to 50% reduction. And this has got enormous implications. And in thinking about how this is linked to the current geopolitics, I have had opportunities in the last year to speak in the European Parliament, to
Mhm.
in the German Parliament, to engage with leaders from North America, the UK, and many European countries. And the single question I've been asked the most in all of these platforms, whenever I speak about the changes in global health being bad not only for low and middle income countries, not only for Africa, but for the entire global community. And the question I've been asked is to constantly justify why high income countries need to invest in health and research outside of their own borders.
Yeah.
And my response repeatedly has been the same, that in a increasingly connected global health community, the concept that you can only act locally is fallacious at best, because one, infections know no borders,
Mhm.
but also when others find themselves in invidious positions, that impacts on global security, but also increased forced migration, and the challenges that countries in the global majority face end up impacting on countries in high income settings. And for me, there are really 4 compelling reasons why we need to consider uh, investment in global health as a key global imperative. The first is that research underpins health security. And so the COVID-19 epidemic, in my view, really highlighted a stark truth, that countries with strong research ecosystems built over years were the first to sequence viral genomes, to develop many of the effective diagnostics, design vaccines, deliver evidence-based responses. And on the other hand, countries without this capacity had to wait. And we know that in public health, waiting costs lives. The
Yeah.
second reason is that global health research is an economic engine. Biotechnology, pharmaceuticals, diagnostics, digital health, and medical devices are amongst the fastest growing sectors globally. And nations that fail or are unable to invest in science and scientific research remain consumers of health innovation rather than producers of innovation, and therefore are locked out of high growth knowledge economies. The third reason is that science, and in particular health research, strengthens sovereignty. And so global supply chains for vaccines, for reagents, for laboratory consumables, and investigational products are fragile at best. And when external funding declines, as we have witnessed in the past year, as was the case during the COVID-19 pandemic, nationally driven research capacity becomes essential for autonomy and preparedness. And then finally, global health research is fundamental for driving equity and reducing the inequities that we see in this world. A system that relies on imported knowledge of externally defined priorities inevitably produces blind spots. Our disease burdens, infections like HIV, TB, malaria, rising NCDs and metabolic disease, and of course, the mental health crisis, all need locally led science. Without it, the most vulnerable populations in our context are left behind. And so I think these four core reasons provide compelling reasons why it should be everybody's business to support global solidarity and global research for the good of the world, and to use science as a common good and a unifier.
And it sounds like you are approaching borderline the conversation of science diplomacy, and the use of science really build the case, the investment case for why funding of science is actually good, even not only in global north, in countries that are quite rich, high income countries, but also for middle income countries. I wanted to take you a bit back to your conversation or your point on the question you were being asked at the EU. When they invited you, they had a lot of money, but and thank you also for answering on which countries they are, because I know that you said 5. We always know US is the biggest one because of what has happened this year. They pulled out and everyone was suddenly left shocked, and we can see the repercussion for that. But you use this phrase, which I quite like, global majority. And you mentioned about the climate change, pandemics, food insecurity, all those are interconnected across the world and across borders. So I wondered, when you're asked this question at the EU level, how would you respond to such a question if the community was to ask you a similar question on why make similar investments? Even when we're looking at our own African governments, what is the case for them to really pivot? If they were looking at military or tourism, maybe for them they need to relook at science funding, at research and R&D. The investment by the South African government and the partnership with China for the genomic sequencer is a good example. So if you had community in there, and they're asking the question, what case would you build for them?
So I think the case for countries in the global majority, so this is a term I prefer to use rather than what I consider to be pejorative descriptions of the global north and global south, which really place the north and south in a relationship of asymmetry.
Yeah.
And so the argument I would make is one that it goes without saying that governments in the global majority need to invest in the health and the health research of their own populations. And by doing so, they move us away from the current perverse reality where donors and philanthropists have such significant control on the agenda for research in terms of which institutions are funded, what research questions are prioritized, which PIs benefit from research funding. And this necessarily means then that if governments are the ones funding their own research in their countries, funding decisions have to be informed by local priorities. But what this does, it also builds an opportunity for culturing really meaningful partnerships and networks, and cultivating a community of practice among scientists within the global majority for shared learning and sharing experience, to really, in parts of the world where people have similar contexts with similar challenges and similar goals for their research agendas, to be able to work much more closely together. And it also means that scientists in the global majority, supported by their governments, also then have an opportunity to address the widening disparities in relation to questions of diversity, equity, and inclusion without facing the pressure from nationalistic and supremacist governments that see these considerations as wokeism or reverse racism.
Yeah.
And ultimately giving us an opportunity to really address these intersecting systems of privilege and supremacy that hinder through equity and justice in health.
So Ntobeko, I also want to spend this second half of the podcast now exploring some examples. You've given some fantastic examples, even the EU one, the gene sequencer in terms of the partnership for China, South Africa, and the benefits to the entire continent. Let me move on actually to the science activism question and really say that, we're looking at everything this year, especially the impact of global politics in our lives. What responsibility do you feel scientists and research institutions in the global south, and maybe now I need to stop using the word global south. I think we've agreed that global majority might be a better phrase. So what responsibility do researchers in the global majority, and who make up 85% of the world population, have in terms of meeting the political realities we're currently finding ourselves in? It's very clear now that health is political, that sometimes we seem to have lost agency. What maybe top 3 guidance would you give to motivate the scientists to take agency or become activists?
Yeah, so I think there are a number of really compelling reasons why we need to have greater agency in global health as scientists from the global majority. The first is that if you look at where knowledge generation in global health comes from, most of it emanates from the global majority.
Mm-hmm.
And when you look at where the benefit of that knowledge production accrues, it accrues to scientists and institutions, mostly from high-income country settings. And so this is a perverse situation that is both untenable and unsustainable. And we need to change this. And so to be able to change this, scientists from Africa and many other settings in the global majority need to claim their space and their voice in global health that is proportional to the size of their problems in this world, that is proportional to the size of their populations in this world, keeping in mind that the global majority or low and middle income country settings make up 85% of the world's population, but
Right.
also claim that space in a way that is proportional to the size of their aspirations in moving the health of their own populations forward. And alongside this activism and advocacy, scientists also need to see their role in science diplomacy, being able to engage politicians, decision makers, civil society, to really understand why science is important for society, and for science to truly emerge as a bridge builder across political, cultural, and economic divides, but also to emerge as a source of trust and evidence, particularly in polarized contexts, a driver of equitable global governance, and as an advocate for inclusion in global research and innovation. And this inclusion is particularly important because without it, it means that scientists from the global majority and their work remains underrepresented in global scientific discourse, and local solutions, even when evidence-based, will remain underdeveloped or underrecognized. And so really challenging all of us to be not only scientists, but to roll our sleeves and be involved in advocacy and in science diplomacy.
I mean, also, again, from your presentation, I really loved this. I believe it is a quote that we can attribute to you. We do love quotes by scientists. And, for you, your emphasis is that science is seen as a unifier, a space where trust, evidence, and cooperation literally transcends politics. And one of the things, even for this podcast, and I should have started by saying, we're getting to the 30th episode of Connecting the Dots podcast. And our very first guest was a former president of Mauritius, who was a scientist. So I guess the question I have for you is, would you take it a step further and advocate for scientists to also join politics, to be able to challenge some of the narratives, challenge. I love how you talked about health being something that we need to push it as equitable, and politics, unfortunately, plays a key role. So sometimes I feel like we need the scientists in the political spaces because they have the evidence, they have the knowledge, they understand to a point diplomacy. I'm not saying anything about our political leaders, our current political leaders, but sometimes even in arguments, you hear arguments that are not based on fact. If anything, they do straddle misinformation, myths, and misconception. So I don't know, what do you think about pushing scientists a little bit? In addition to activism, perhaps they should also get into politics.
Yeah, that's one thought. But many people don't like politics, and politics these days is a dirty word.
It's a dirty game.
When I think about our work as the SAMRC, I think we still manage to do two things very well. One is to give systematic thought to how we communicate science, to affirm its value in society, and to develop strategies of how we communicate, when we communicate, and how we communicate to different groups. And we see this to be particularly important in this era of receding trust, not only in governments, but in science itself. And to use evidence and the voices of individuals who are trusted to deal with both disinformation and misinformation. But the other approach that I think we employ quite effectively without necessarily being politicians is that we are an entity of statute, a public entity that supports the work of our government. And because we see ourselves both as the custodian of health research in South Africa, but also as the government's arm on health research, we're able to go into many spaces, parliamentary portfolio committees, our National Planning Commission, the Office of the Presidency, and in the working groups and committees of key ministries like the Ministry of Health, the Ministry of Science, Technology and Innovation, and many others to give input on science deliberations, discussions they are having around planned interventions and policies, and can really influence those in a powerful way without necessarily being the decision makers ourselves.
Yeah. I mean, it's a reasonable response, and it sounds like a good approach also for us to contribute differently, not necessarily even stop doing the science, which is what scientists are trained to do, but perhaps collaborate with institutions like the SAMRC to be able to champion the cause and use science communication. So thank you also for referencing that, because that is a subject that's always close to my heart.
As part of our mandate as scientists to really translate the knowledge that we generate into outputs that ultimately benefit the communities that we serve. And so we do that translation in many ways, but the ability to produce issue briefs and technical reports so that decision makers are able to digest science that is not always accessible in a way that informs their thinking. We provide platforms to support evidence synthesis for politicians so that they are able to make their decisions fully informed. And I think these are roles that as scientists we should see as part of our mandate beyond just knowledge generation or application of existing knowledge in new ways.
Ntobeko, what lessons would you suggest that we carry forward into 2026 as we wrap up 2025? And then what do you feel that we should definitely leave behind in this year?
Yeah, so when I reflect on the past year in particular, but perhaps the recent period, I think that the COVID-19 pandemic had many hard lessons for us. And I think that the withdrawal of the US federal funding had even harder lessons for us this year. And so in thinking about how we continue to build a health enterprise that is resilient, is relevant, is responsible, and is responsive, there are five key lessons for me. The first lesson is that preparedness is built before crisis. And so rather than being reactive at the time of crisis, we should be constantly thinking around how we build our systems, our processes, so that we are prepared to encounter the next crisis. The second is how we think about data and data systems. And these must function in real time. There is no point in building data systems that allow you to respond in a year's time. You need data that enables you to make real-time decisions in days or in a week without having to wait months or years to get the evidence that informs your decisions. And then the third critical lesson for me has been the importance of local manufacture with the kind of vaccine apartheid, the rising nationalism. It's really important that countries in Africa and in many other contexts of the global majority, we have the ability to produce our own diagnostics, our own therapeutics, our own vaccines. And then the fourth is the importance of not relying on external evidence to inform your planning, but for local evidence to drive local decisions without needing to show on solutions for your own context based on what has come from other people's work. And so we need to produce relevant data that informs how we think about appropriate solutions for our own contexts. And in the era of receding democracy, receding multilateralism, and receding trust in global cooperation, global solidarity is clearly inconsistent. And so one cannot overstate the importance of self-reliance in every aspect of the scientific endeavor. And for me, these five lessons have been the five key lessons to have come out of both the COVID-19 pandemic, but also the funding crisis this year.
And Ntobeko, as we wrap up, what is the one thing that gets you jumping out of bed every morning and excites you to come to work and be able to tackle?
It's the thought around health disparities and health inequities and how I can use my voice, my resources, my capabilities, my networks to constantly think around how we reduce these disparities and inequities. And that's the one thing that keeps me awake at night and keeps me excited to get out of bed to fight a good fight and continue working with you and many like-minded people who want to see a fairer, more equitable health system and world.
Okay. And your parting shot or your one sentence that you want to leave everyone with as we close the podcast?
I really, I'm an idealist at heart and would love to see a world in which we can realize greater solidarity as the basis for equitable and sustainable partnerships to lead us to a new era of global health and how we think about the fundamental and often intractable challenges of the world we live in.
Ntobeko, thank you very much for your time this afternoon, for imparting a lot of the insights that you've shared and giving us even hope in a year that has been, challenging at best, but has shown that we do have resilience, for reminding us that we have voice and we can also have agency. We definitely have a lot to learn this year. And I would also like to thank, as we wrap up the Connecting the Dots podcast series for 2025, I'd like to really thank all our listeners and all the feedback that they keep giving us. Keep the conversations going on all our social media platforms, CTD Pod Africa on LinkedIn, Instagram, and YouTube as well. Tell us what you think we should leave behind in 2025 and also what we should bring with us as you've listened to Ntobeko and the feedback that he's given us today. As always, stay curious, be bold, and keep asking the question, why?